makes sense. So it's great hearing about like how your specific sites have been doing with regards to COVID, but I just had a more general question to pose to both of you. So like with your experience and like background in working with global health and public health, I was just wondering what challenges do you think in general come with tackling COVID in low resource settings? Like maybe with regards to like social distancing measures and other things like that.
Great question. So I think that oftentimes the problems that we see here in the US or in Western countries are or can be exacerbated in low resource settings. There's currently ongoing in the debate between economic failure and then health failure and weighing the risk of reopening economies to the risk of increasing the transmission of the virus. And so a lot of times in low resource settings, that is also a very real conversation that has to be had. And a lot of times families have much less of a safety net financially to be able to rely on. Things like I think of dissemination of information can be really difficult in very rural, low resource settings because not everybody necessarily has access to the internet. And also the information that people do get can vary greatly depending on what the government is telling the population within the country. And so that can change how people address the virus and how easy it is to tackle it. On the other side of pieces of the puzzle is governments in more authoritative roles. We've seen a lot of a military presence in a lot of the countries where we work, and so citizens are only allowed to exit their homes on certain days of the week, and they're only allowed to go outside for food, so going to a grocery store, to go to a bank, or to go to a health facility, basically a hospital. And so having that much restriction on people's ability to move and people's ability to just be outside, because I know at least here in the US, people have still been allowed to go outside and things like that. And that's really, really helpful in terms of maintaining good mental health during a pandemic. And so that can have a huge impact on how countries tackle COVID and how people react to the measures. Nick, did you have anything else?
Yeah, thank you. I think you touched on a lot of great things here. Maybe in a couple areas that I'd like to add to is that we would also see many of the same things that you might see in higher resource settings, lack of testing or lack of access to testing. Not just talking about Uganda, but I think many countries within Africa where you see in the spread of COVID being a bit more delayed than other areas of the world. There's been a lot of emphasis on testing for folks returning to country when they still could, or maybe the limited populations that might still be able to cross borders, like people transferring cargo and things. So a lot of emphasis put in those areas. But then what does that mean for people that are in country, have been in country, that may have even less access to testing? I think as well to supply limitations and uncertainty around supply within some low resource countries that receive a lot of things from outside their country. They're not producing a lot of things or manufacturing a lot of things. They're really subject to the supply of things like medicine or PPE or medical equipment. While some industry might be able to pivot within country to be able to produce some of this, it can be really limited, and they might just be subject to whatever they can still get coming in. Another area might be on uneven supply distribution within the country itself, whether it's those materials, like I just said, or if there's government initiatives, like we have seen in some countries around like food distribution. There can be some uneven amount of distribution into more prosperous areas or larger cities, and sometimes the trickling down into less populated or poorer areas of the country, that might come slower or not at all, which can definitely be a challenge.
Yeah, I guess you both touched on the fact that this pandemic has affected countries very differently. So my question is, have you seen a difference in the way COVID has affected individuals and specifically families in varying places around the world?
Yeah, I think it certainly affects people differently no matter where you live. And so it can be across countries, it can be within the same country, even the same community. It can affect the people living in the same community differently, right? I think social determinants of health are a huge part of how it impacts families, where you are born, live, work, grow, and play. But it also has a huge impact on an individual's mental health. And so that is a very individual and personal piece of how it can affect you. And so I touched on this before, but when you're in a pandemic and, you know, the main recommendation is to isolate as much as possible and to quarantine, we really, as humans, are interconnected. And so it becomes very difficult mentally when you aren't able to have those normal interactions with others. And so that's a way that it can affect every individual differently, no matter where you're living in the world.
Yeah, you've made some great points there, Madeline. I think maybe just to add a little bit there as well too, is that thinking about one of the biggest challenges right now is around the question, or answering the question of when might this end, or when might we return to some kind of feeling of normal, and no one can really say, because some folks, again, might be more impacted or less impacted than others, but those safety nets that they might have, whether it's financially or with job positions, are larger or smaller or non-existent. So as things continue to move along as they have been and are continuing to, and this could be stretching on for a longer period of time, I think you'll see some of these disparities grow even larger, and looking for ways to address them will be some of the near-term big issues that need to be solved.
Yeah, like you mentioned, like things like social support that is offered to communities is very important in kind of the impact the pandemic has. I was kind of just wondering, so like in Baduda and also like other FIMRC project size, like how has social support from the government been like as compared to like North America?
From a support from like a government perspective, we have seen, like I said before, some government interventions, mostly around like food support, different from what we've seen in the U.S. with some level of like stimulus support or unemployment support. That's less seen in places like Uganda. So those food rations, certain amounts depending on if you're able to work or not. Food rations have been going out into different areas. As well, another thing that the president talked about a few weeks ago was that the government would be issuing cloth masks to every resident within the country 6 years of age or older. So they've been working on manufacturing and getting supplies of those. And I think they're just now starting that distribution process to everyone throughout the country. But we're hoping that it's moving along as quickly as possible and making sure that it gets to every member that it's supposed to get to. But those are kind of some of the bigger government initiatives that we've seen in the area. Otherwise, it's mostly been, pretty well locked down. Uganda is a very agriculture focused country, so a lot of the communication has been around, okay, if you're not able to work, you're still able to supply food to your household or within your community, because under the assumption that most everyone farms or gardens in some way, which is true, but can be, for some folks, a strong assumption that they might not be able to access enough food or enough variety of food to make that really a possibility for them.
I think Nick pretty well covered what Project Vidita in Uganda is looking at for social services. I think when you're looking at low resource settings in general, social services are really hard to provide to the entire public. And so, it's a really, really hard spot to be in when you're struggling in so many different aspects, and to be able to provide those. So I think a lot of our countries that we work in are facing similar pieces to Uganda.